Gentlemen, if you're a man over 60 and you're looking to significantly boost your erectile strength and overall male vitality, listen closely. As a urologist, I'm about to reveal a simple 3-minute daily exercise that can genuinely help you reclaim that confidence and vigor. This isn't about quick fixes or magic pills. It's about a proven, science-backed approach. So stay right there. We're diving into exactly how you can maximize your intimate health for years to come. Welcome back. In all my years as a urologist, I've learned that a man's confidence often goes hand in hand with his overall well-being, and sexual health is a huge part of that. Most men are shocked when I tell them this, but penis size and erection hardness don't decline because of age alone. They decline because of something almost no one talks about: loss of blood flow efficiency. And the worst part, most men are unknowingly making it worse every single day. If you're watching this right now, especially if you're over 30, stay with me, because in the next few minutes, I'm going to explain a 3-minute daily exercise that supports stronger erections, better hardness, and helps you reach your natural size potential. And I'll also show you the one mistake that cancels all results if you do it wrong. I'm Dr. Marianne, a urologist, and I've worked with thousands of men who thought their situation was normal aging. Men who believed weaker erections, less firmness, or reduced size were permanent. But once we corrected how their pelvic muscles and blood vessels were functioning, many of them noticed changes they never thought were possible without pills or surgery. Let me be very clear from the start. This is not magic. This is not an overnight transformation. And this is not about exaggerated promises. This is about biology, circulation, and muscle control, the same principles we use clinically when helping men regain erectile strength. Here's something most men don't realize. An erection is not just about arousal or testosterone. An erection is a vascular event. Blood must enter the penis quickly, stay trapped efficiently, and be supported by surrounding muscles. When any part of that system weakens, erections become softer, shorter, or inconsistent. Over time, this can even affect perceived size, because full expansion isn't being reached anymore. Now let me ask you something important. Have you noticed that erections don't feel as firm as they used to? Maybe you need more stimulation. Maybe you lose hardness halfway through. Maybe morning erections are weaker or gone. These are not random issues. These are early signals of reduced blood flow efficiency and weakened pelvic floor engagement. The good news is this: muscles respond to training at any age. Blood vessels respond to stimulation, and the pelvic floor, which plays a critical role in erection quality, can be reactivated if you train it correctly. But here's where most men go wrong. They either do nothing or they jump into extreme exercises they found online, squeezing too hard, too often, without understanding what they're actually training. That leads to tension, pain, and worse performance. So before I explain the exercise, let me explain what we're targeting. There is a group of muscles at the base of the pelvis that help compress veins during an erection. When these muscles contract properly, they help trap blood inside the penis, increasing firmness and duration. When they're weak or poorly coordinated, blood leaks out too quickly. That's when erections feel soft or unstable. The exercise I'm about to explain focuses on controlled activation, not force, and that's why it only takes 3 minutes. First, you need to identify the correct muscle. The easiest way is to imagine stopping the flow of urine midstream, but do not practice this during urination regularly. That stopping motion is the muscle group we're targeting. Once you recognize it, you're ready. Sit or stand comfortably. Relax your abdomen, thighs, and glutes. This is important. If you're clenching everything, you're doing it wrong. Now gently contract that pelvic muscle for about 3 seconds. Not hard, just firm enough to feel engagement. Then fully relax it for 3 seconds. That relaxation phase is just as important as the contraction. This slow, controlled rhythm is what trains both strength and coordination. You'll repeat this contraction-relaxation cycle 10 times. That's your first minute. During the second minute, we add something subtle but powerful. As you gently contract the muscle, focus on your breathing. Inhale during relaxation, exhale during contraction. This improves oxygen delivery and neural activation. Many men skip this step and they lose half the benefit. Now, during the third minute, we focus on endurance. Light contraction, held for about 5 seconds, then fully relax for 5 seconds. 5 repetitions. That's it. 3 minutes total. No strain, no pain, no aggressive squeezing. Men who do this correctly often report improved erection firmness within a few weeks, especially when combined with better sleep, hydration, and reduced stress. Some also notice improved control and confidence, which plays a larger role in sexual performance than most people admit. Now let me talk about the biggest mistake I see. Men overcontract. They think harder is better. It's not. Over-tightening the pelvic floor can actually restrict blood flow and cause discomfort. If you feel tension in your lower abdomen or buttocks, you're doing too much. Another mistake is inconsistency. Doing this once and expecting results won't work. This is a daily exercise, 3 minutes every day. Brush your teeth, do the exercise. Simple. I also want to be very honest here. This exercise supports natural potential. It does not turn you into something unrealistic. What it does is help you access the firmness and fullness your body is capable of when circulation and muscle function are optimized. Some men ask me, how long before I see results? Most notice subtle changes in 2 to 4 weeks. Stronger morning erections are often the first sign. Hardness improvements usually follow. Consistency over 8 to 12 weeks brings the best outcomes. Now, who should not do this? If you have pelvic pain, recent surgery, or a diagnosed pelvic floor disorder, you should speak to a healthcare professional before starting. Never ignore pain signals. Let me also say this clearly. No exercise can replace medical care when it's needed. Erectile dysfunction can sometimes be an early warning sign of cardiovascular disease. If you're experiencing sudden or severe changes, consult a doctor. But for many men, especially those dealing with gradual decline, this simple daily habit can make a real difference. If you've stayed with me this far, that tells me something important. You care about your health, your confidence, and your future. And that already puts you ahead of most men. If you want more doctor-explained, science-based men's health content like this, make sure you subscribe. If this video helped you understand your body better, like the video so more men can see it. And if you want a follow-up video covering foods, habits, and mistakes that silently kill erection strength, comment next below. Your health matters, your confidence matters, and taking 3 minutes a day is often where real change